are at the Anschutz campus, counting down. We're getting ready to start the protest here. I just want to jump on here live, just stating a disclaimer. We are not for or against the vaccination. We are merely standing up for the American citizens, our rights, and our medical freedom to choose what we do with our bodies. This vaccination is experimental and not FDA approved, and we are here to stand up not only for us, but for our children, our families, and generations to come. Why are we not talking about natural immunities?
It should not be forced upon us to either vaccinate or lose our livelihood.
I'm happy to say that 90% of all our employees are currently vaccinated. So we actually have hit a huge threshold in terms of, we started about 80% and we just keep working on it and getting that up to this where we want. And then obviously the goal is 100%. Our deadline is October 1st for everybody to have completed their series. So it's not, oh, I got my vaccine or I had an appointment. I have finished the series by October 1st. There will be disciplinary actions up to termination as of October 1st that will be implemented.
You know what? I've been in the healthcare community for over 20 years, and I've seen a lot of things change. And I think that one thing that's really missing is having our rights being okay.
We do not consent!
Give us our right to say no.
Stop the mandate!
I think this is why we live in the United States and that we have the ability to do that. And I think people should be able to express their opinions. I think they should be able to, we should respect that they can do this and should do this if they feel the need. But I think at the end of the day, I think patients will recognize it's just a few groups of people that potentially are in this situation, and that the vast majority, with 90% of our staff and employees vaccinated, most of them don't feel that way.
Medical freedom, right? I don't see it right now, and I want it back. My residents deserve to have that back. They do not deserve to have us gone because we refuse to vaccinate.
I think obviously we want to be respectful of people's individual preferences and their opinions, and there are legal and medical ways to potentially be exempted from this. You can supply forms that say you have a religious or medical reason why you don't need to take the vaccine, but at the end of the day, we feel strongly that the vaccine is the #1 way we can provide protection to our employees, to our staff, and most of all to our patients in the community. And so at the end of the day, while again we want to be respectful and there will be instances in which someone will be exempted from the vaccine, we think this is the right thing to do.
It just hasn't been out long enough for anybody to sit there and know what the real side effects are. Everybody says it's safe, but you can't really say it's safe if you only had it out for, 18 months? Not even that? And like she says, natural immunity, there's other ways to go about it. But anytime you tell somebody that this is the only way you can go about it, red flags are coming up for me.
Through the pandemic, I contracted COVID, and that was a very scary situation. I have natural immunities. This is one of my other arguments. Why is the government, why are these people not talking about natural immunities?
I think at the beginning, when we first were questioning whether or not those with immunity really needed to have a shot, was you could wait initially. Now we have very good data looking at individuals that received vaccination, did not receive vaccination, and looked at whether or not the rates of reinfection in those groups are the same. It's not. If you just had natural immunity, your risk of getting reinfected is twice the amount if you got vaccinated. And this just has to do with the changes in the virus as well as the breadth of your immune responses. And so even if you had COVID in the past, there is no reason not to get vaccinated, and it's in your interest because we do know that people get reinfected, and often that reinfection is more severe than the first round. And so the goal again is to keep everybody healthy and safe.
My children are all vaccinated. They go to public schools. I'm here to stand up for our rights. I see that our government, our federal government, our state government, they're coming down and they are trying to take our rights away as American citizens. I'm an advocate all day long for my patients, and I always have been. So why are we as healthcare providers being forced to do something that we don't even force our own patients to do? I'm not only standing up for nurses, healthcare workers, it's in every sector now.
We need other employees who are afraid to speak up and are feeling alone to know that they're not alone, and that, you know, if they're having the same feelings that we are.
Medical freedom!
We still care about patients. We still care about the outcomes of patients, and we've always been fierce advocates, and now we're just advocating for ourselves. We're still patients at the end of the day. This is still medicine. It's still a medical procedure, and we deserve the same right to say no.
I have had individual conversations with people to try and understand this, because it's not a one-size-fits-all. There are lots of reasons why people sometimes need to just process and think through. Sometimes that's been successful, sometimes they're still thinking about it, and some individuals perhaps will decide that healthcare is not what they decide to do in the long run, because this is not unique to us. If you look across the country, most healthcare systems are doing this. Almost every medical society, nursing society, pharmacy society has recommended that this is the way to do this, because it is the most effective way for us to be able to protect patients, staff, employees, and the community at large.
We do not consent!
And I worked a shift last night, came straight from work.
No way!
Because I feel like our freedom's in jeopardy, and we need to stand up for our kids and stand up for our rights.
Allow for compassion, because we're all humans. My job is to, again, make sure that they have the appropriate information and that we do the best we can to understand where they're coming from, recognizing that at the end of the day, this is still going to be what it is. And the overall versus the individual, when you look at public health and community health, it's about that larger goal, and it sometimes doesn't always impact the individual the way we would like to, but it's what it is.
It's been very difficult. You know, we went from being heroes to now being mandated to take a vaccine and an experiment that we're not comfortable with. And it's an interesting turn of events, and it's sure been an interesting year.
If you do not have a viable religious or medical exemption, then that is the process. So it's either you get your vaccine or you've applied for an exemption through our process and you've been approved, and that's the end of the story.
I would hope that the administration reverses their decision and at least allows testing, and I think that would be a safer way to approach this anyway. We're not anti-vax, we just are anti-experiment. And I don't feel like the humans should be a petri dish or an experiment. So.
Safety data from the vaccine has been collected worldwide. It's hard in my mind to imagine that we would have that much cooperation across the world to have the same messaging without there being some discrepancies. Over 1.8 billion doses of vaccine have been given worldwide. This is the most scrutinized vaccine that's been given in our history. And I think the fact that they are finding these side effects and potentially really rare serious adverse events means people are looking, because if you look at the numbers, it's like 4 in a million or 1 in a million. And the fact that they're seeing this, following it, looking at and observing what happens, I think that's a testament to the fact that it is good science and people are being transparent as to what's actually out there.
What about FDA approval? Would that change your thoughts?
It may. It definitely would. I would rethink my decision. I know there's potential for some safer vaccines that are coming out, and one in particular called the Novavax. Hopefully we may have access to something like that would be safer for us.
1.8 billion doses across the world with lots of reporting mechanisms and a lot of scrutiny of all this data. I don't think the FDA stamp of approval would have changed my mind in terms of what the safety data has already shown us, that it is safe, it is highly effective, and it is the way we are going to get ourselves out of this pandemic.
My body, my choice!
If you're vaccinated, you are less likely to be hospitalized and die. And at the end of the day, while transmission obviously is a huge part of what we're trying to conquer, keeping people alive is important as well.